the expected rise in cases, more people in hospital, and sadly more will die. Can you tell us how bad you expect it to get after July and the restrictions being lifted? And to Professor Whitty, are you confident that hospitals can cope with this wave of cases? And to all three of you, in what circumstances would you continue to wear a mask?
Thanks, Vicki. I think the answer is that obviously we have to be cautious, and we will continue to look at all the data as we progress. But don't forget that we always did say there would be a third wave, and the projections when we outlined the roadmap were for sadly more hospitalizations and sadly more deaths. I think the question that people have to ask themselves, as I said earlier on, is if we don't go ahead now when we've clearly done so much with the vaccination program to break the link between infection and death. If we don't go ahead now when the summer fire break is coming up, the school holidays, all the advantages that should give us in fighting the virus, then the question is, when would we go ahead? Particularly given the likelihood the virus will have an extra advantage in the colder months in the autumn and the winter. So we'd run the risk of either opening up at a very difficult time when the virus has an edge, has an advantage in the colder months, or again putting everything off to next year. So I do think it's going to be a very balanced decision next week. I want to stress that this is what we're really doing today, is setting out the conditions that we expect us all to be in from July the 19th. We're not taking the final decision until July the 12th. And on your question about will I personally wear a mask, I think that as I said earlier on, it will depend on the circumstances, and I think that what we're trying to do is move from a universal government diktat to relying on people's personal responsibility. And clearly there's a big difference between travelling on a crowded tube train and sitting late at night in a virtually empty carriage on the main railway line. So what we want to do is for people to exercise their personal responsibility, but to remember the value of face coverings, both in protecting themselves and others. But I know that Chris and Patrick want to add to that.
Shall I answer the NHS question?
Yes, sorry.
And then I'll talk about my view, masks. Patrick will add his. The NHS is an emergency service, so at one level the answer is it will cope with anything because it is an emergency service. But we, as Sir Patrick pointed out, there is now a doubling time for numbers of cases going into hospital. The number of cases going in a day at the moment is relatively low compared to previous waves, around about 300. But if you double up and then double up and then double up and double again, at a certain point you get, and in fact in a surprisingly small number of doublings, you get to really quite high numbers. So the question is, at what stage along this path are the doublings times getting to the point when the numbers are very high before we actually lead to a reduction, because the peak of the epidemic happens. And what the modelling would imply is that we will reach that peak before we get to the point where we have the kind of pressures we saw in January, for example, of this year. But inevitably, with all models, you have to say there is some degree of uncertainty. And so, we are dealing with uncertainty, and the Prime Minister and ministers are having to make difficult decisions with uncertainty as part of the decision process. In terms of wearing a mask, I would wear a mask under three situations, and I would do so particularly at this point when the epidemic is clearly significant and rising. And the first is in any situation which was indoors and crowded, or indoors with close proximity to other people. And that is because masks help protect other people. This is a thing we do to protect other people, as it's by far its principal aim. The second situation I do it is if I was required to, by any competent authority, I would have no hesitation about doing that, and I would consider that was a reasonable and sensible thing if they had good reasons to do that. And the third reason is if someone else was uncomfortable if I did not wear a mask, as a point of common courtesy, of course I would wear a mask. So under all those circumstances, I would do so.